Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera. Yang amat berbahagia Datin Paduka Seri Jeanne Abdullah, Chancellor of Open University Malaysia. Yang berbahagia Profesor Dr. Mansur Fadil, Senior Vice President of OUM. Yang berbahagia Profesor Engineer Dr. Rosli Hamir, Vice President of OUM. Yang berbahagia Puan Hajah Fadilah Abdullah, Pengarah Kejururawatan Kementerian Kesihatan Malaysia, merangkap pendaftar Lembaga Jururawat Malaysia. The management and staff of Meteor and OUM, members of the media, our distinguished guests, ladies and gentlemen. First of all, may I extend our heartfelt gratitude to Yang Amat Berbahagia Datin Paduka Seri Jeanne Abdullah, our beloved Chancellor, for taking time off to address the staff this morning and later to launch the School of Nursing and Allied Health Sciences. Datin Seri, when I read, I'm always nervous. We are truly grateful to have Yang Amat Berbahagia Datin Paduka Seri here today to be part of this momentous occasion. Despite a heavy schedule, Yang Amat Berbahagia has always been receptive and encouraging all our OUM initiatives. When OUM was formed in 2001, the aim was to democratize education by reaching out to the masses irrespective of age and economic background. Today, true to its motto, University for All, OUM now has a cumulative learner population exceeding 76,000. This is a testament of the trust learners have in the university, and in return, OUM works tirelessly to live up to its learners' expectation by being a learner-centered institution. OUM has now more than 13,000 graduates who act as opinion leaders to those working people who are planning to pursue their tertiary education. Today, I feel proud that OUM will add another milestone in its development with the launch of its School of Nursing and Allied Health Sciences. This marks the first event for this year, and I'm truly heartened to begin 2009 on such a promising note. Though the world is expected to be punctuated by adverse outcomes due to the economic downturn, we at OUM are as hopeful as ever to do our very best for our learners. In these trying times, education is an excellent gift people should wish for themselves, as it provides the necessary tool for leading an enriched life. I am pleased to mention that our January semester intake is among the highest in recent years. Distinguished guests, ladies and gentlemen, as known to many, the nursing profession was pioneered by Florence Nightingale in the 19th century. Since then, millions had followed her footsteps to serve the sick and the elderly. Long ago, there was a biased perception that nursing profession doesn't need qualification and the extra knowledge. But in this modern age, the scenario has changed so much, and nurses are encouraged to widen their knowledge and skills through tertiary education. Tending to patients who are fragile and vulnerable is not a mean feat. What more with the emergence of new diseases and medical equipment. The nurses must also rise to the occasion and there is no other better way than turning to learning and knowledge. To me, the contribution of nurses is nothing less, if not at par, with our doctors. In medical care, doctors diagnose patients, but it is a tender care and attention to nurses which speeds up the recovery process. In Malaysia, tertiary education for the nurses was introduced in 1999, and statistics shows that so far there are about 6,000 graduate nurses who have completed their degrees from 17 nursing colleges nationwide, including public and private higher education institutions. To meet the market demand, OUM's Bachelor of Nursing Science program was introduced in 2007 with 92 learners. The learner number has grown exponentially, which now exceeds 800 with the support of the Kementerian. It is interesting to note that OUM has also about 10 male nurses pursuing the program. It's good for the male. They also care. We're happy to say that the first batch of Bachelor of Nursing Science students will be completing their studies this May and inshallah graduating with our Chancellor in the 7th convocation in November. This remarkable achievement has further motivated OUM to unveil new programs that are expected to hugely benefit nurses in enhancing their capacity and professionalism. The programs in the offing are Diploma in Pre-Hospital Emergency Care, Advanced Diploma in Clinical Nursing, Degree in Health Sciences, and Masters of Nursing Science. This program will be offered in stages, and the school is expected to function fully by the year 2011. Ladies and gentlemen, what makes OUM nursing programs unique is the fact that the nurses can pursue their studies while working full-time in the hospitals. As the programs are delivered via open and distance mode, learners can work and study at the same time. In addition, these nurses can do their clinical practice at 24 government hospitals nationwide. This was made possible following an agreement signed with the Minister of Health last year. During the signing ceremony, the Minister of Health, Yang Berhormat Datuk Liao Tiong Lai, shared his concerns over the shortage of nurses in our country. I feel that there is a pressing issue as our qualified nurses are very much in demand, especially in the Middle East. To counter this problem, the Ministry announced that plans are underway to introduce an attractive salary scheme to amply reward qualified nurses, like we have done at OUM. He believes that the new scheme will set the stage for achieving an ideal ratio of 1 nurse to 200 patients by the year 2015. I'm sure that this peace announcement is welcome news to in-service and potential nurses. Therefore, they have all the reason now to continue their learning process. As for the future of this school, OUM is looking far beyond our borders. We are eyeing the opportunity of exporting, if possible, our nursing programs to Vietnam and the Kingdom of Saudi Arabia, which have shown interest in our program. We are optimistic that our ambitious pursuit will bear fruit and thus reaching out to wider audience across the globe. At OUM, we strive to offer quality programs and services to our learners so that their knowledge and competencies will make a difference to the people around them. Last but not least, may I, on behalf of OUM, thank both the Ministries of Education and the Ministry of Health for their guidance and support in making available the programs on nursing science and other allied health sciences to the public, especially for in-service nurses. We also wish to thank the ministries for allowing us to use the facilities provided by the hospitals, as I said, nationwide. The ever-willing assistance from the Nursing Board and NQA, Malaysian Qualification Agency, has led us the path towards achieving excellence in the field of nursing science. With this, ladies and gentlemen, it is an honor for me to invite our Chancellor, Yang Amat Berbahagia Datin Paduka Seri Jeanne Abdullah, to officially launch the School of Nursing and Allied Health Sciences. Thank you.